Okay, so what we're now going to do is talk about some common individualized assessment. As you know, we'll be following along with ones that you're going to frequently see administered. You might occasionally be asked to participate in the administration of, or you might just want to understand some common ways in which people generally assess individuals on the spectrum. There's a number of them that we'll explore in some more detail. There'll be additional lectures on them, but this is the overview to kind of help you understand the ways in which we assess individuals with autism. So we're going to look a little bit at the ABLS, the VB-MAP, the CALS, the AFLS, the SSIS, and preference assessments. All of those are things that are commonly done. The ones that are most commonly administered are the ABLS, the VB-MAP, and the AFLS. In terms of assessment of goals or abilities, and preference assessments is done to make sure that we are objectively using items likely to motivate learners in our instruction. So let's look at the ABLS. Again, you're going to look at this in a lot more detail, but the ABLS gives us an assessment of basic language and learning skills. It can be used as an assessment guide, a curriculum guide, and a skills tracking system. It's designed for individuals with language delays, and it enables the review of progress over time. One of the nice aspects of the ABLS is there's a visual grid that's used to help portray the level of performance and identify skill deficits of learners. There are 25 basic repertoire areas, a total of 544 skills that are tracked on the ABLS, and the content is very interesting. One of the nice areas is the inclusion of something called basic learner skills, where a number of different items are looked at, including cooperation and reinforcer effectiveness, which is rarely included in an assessment and yet is extremely important for individuals on the spectrum who can be, quote, difficult to motivate. There are other areas in the basic learner skills as well: visual performance, receptive language, vocal imitation, requesting, labeling, intraverbals, and then some of the things that really make a difference, particularly for those who might have a chance to be in included environments: spontaneous language, play and leisure, social interaction, group instruction, classroom routines, and generalized responding. There's also academic areas like reading, math, writing, and spelling, motor skills, and self-help skills. Scoring is generally obtained in three ways. Information might be obtained from caregivers who know the individual well. The student might be observed in their natural environment doing a variety of things, or they might be formally assessed, where tasks are actually presented to the learner. Each item has a row of columns that includes the task name, what questions you would ask about the student's skill, examples of those responses, scoring criteria. This is an example of task B14, following instructions to select one of two common items. And the question you would ask is, if you hold up or place two common items in any position and ask the student to select one of them, can he do it? And you'll notice under criteria in the ABLS that the scoring goes from a 1 to a 4. A 1 would be given for a learner who can do this with 2 pictures, a 2 for a learner that can do it with 10 pictures, a 3 for a learner that could do it with 25 pictures of at least one example of an item, and a 4, the highest rating, would be reserved for those learners who can do it with 50 or more pictures and can identify several different examples of those. Once the scoring's been completed, the information is transferred to a tracking grid. The score for each item represents how many boxes are to be filled in. The open circle is to be filled in if a student scores a 0 on the initial assessment, and annual updates identify progress that's made. And that might be through actual teaching and instruction on that particular goal, or it might just be something that improved over time. Here's an example of a learner who is both filling in the circles on where we're at with something and then corresponding filling in a grid on the tracking sheet. Hopefully that makes sense. There are also multiple rows of the 0, 1, 2, 3, 4, and that's because you can use the same sheet to analyze someone's progress over time. So here you have just that first row filled out, but perhaps next year's assessment we'd have the second one, the following year the third one, and so on. Generally, when people use it for multiple years, like I just indicated, they'll use a different color so that you can see that it changes over time. So look at that first row for level 1. The individual got a 3 on that, right? And then they got a 4 the following time. So look at the bottom on the right-hand side, the bottom row, L1. You'll see that that first year, 3 browns are filled in to indicate a 3 for year 1, and then to indicate the progress that came in year 2, blue is used the following year to indicate the progress that was made. The VB map is really designed to assess language and social skill development primarily. It has all the other areas that we noted, but it's considered extremely useful for language and social skill development. It was created by a very famous behavior analyst named Mark Sundberg in 2008, and one of the things about it that makes it extremely unique is that it's based on Skinner's verbal behavior. And that is true for the ABLES as well. It's important to note that while verbal behavior was used by both Partington for the VB map and Sundberg for, Partington for the ABLES and Sundberg for the VB map, Skinner, when he created his taxonomy of verbal behavior, didn't have intervention for language delay in mind. But what both Partington and Sundberg did is they've brought together the teaching methodology of ABA along with Skinner's analysis of verbal behavior. There are 5 components to the guide. There's the milestones assessment, the barriers assessment, the transition assessment, a way to analyze and track skills, and its use for the development of IEP goals. There are 170 measurable learning and language milestones across 3 developmental levels. You will see that the VB map is most relevant for young learners, although its utility goes well through childhood and into adolescence because of the developmental delays associated with so many of our learners. The skills that are assessed by the VB map include some particular areas of verbal behavior, the MAND, the echoic, the tect, and the intraverbal. Those are expressive language skills that you will likely learn more about in many other contexts. There's also listener behavior, meaning receptive language, play, visual perceptual skills, the understanding of linguistic structure, academics, imitation, matching to sample, etc. In conducting the VB map, it's very important to find a baseline level for skills, and that's a concept you'll run into in other kinds of interventions as well. So the assessment is going to look at all those different areas and try to figure out where is the learner now. Now, sometimes we're trying to get an overall level, but most of the time we're also trying to look at the scatter. Most individuals with significant developmental disabilities, and especially with autism, have some splinter skills, strengths, areas where they're unusually good at, compared to areas that they're truly struggling at. I've mentioned before some of the methods of assessment, right? Formal testing, observation, and occasionally observation in the context of time, so looking at how quickly somebody might be able to do something as well. Just like in the ABLES, the scoring sheet will enable you to use this multiple times. And just like the ABLES, you'd use a different color each time the assessment's administered. The skill is scored as correct only if the behavior can be reliably demonstrated. And just like on the ABLES, we have levels at which we can indicate the possession of the skill. Here's an example of an assessment that's filled out for level 1 tacting or expressive labeling. Tax 2 reinforcing items, tax 4 items, tax 6 items that are not reinforcing, spontaneously tax 2 different items, or tax 10 items. And you'll see that the individual doesn't have item 5 at the level to receive a 1 and gets only half credit there. Here's the master scoring form that shows you what it might look like for a level 1 learner who's got some scatter into level 2 skills, who has no scatter into level 3 skills. The checklist of adaptive living skills is designed for all age groups from infancy through adulthood. So for those of you who are working with adult populations, it's, in some ways more relevant to some of the skills that are most important for those individuals. It can be used along with the adaptive living skills curriculum, and it's really looking at how someone can assess and teach and evaluate an individual's skills in the areas of adaptive living. It's focused on 4 environments that are very, very relevant: personal living skills, home living skills, community living skills, and employment skills. Now, in personal living skills, you have all the issues of personal care. So, eating, grooming, toileting, dressing, health care, sexuality, as well as socialization. But really looking at that person's ability to care for themselves, to protect themselves in those domains. Home care, home living skills, is more about taking care of their clothing, planning and preparing meals, cleaning the home, keeping their environment organized, maintaining the home, understanding home safety, and being able to keep oneself occupied with leisure activities within the home. For community living skills, now we're getting into mobility, travel. Can the individual get from one location to another location safely? Can they manage their time so that they could show up to an appointment on time, for example? How are they at managing their money? How are they at shopping? Do they understand community safety? Do they have leisure skills that enable them to participate in the community? And lastly, there are employment skills. What kind of skills does this individual have in searching for a job, in performing a job, in a work-related attitude context, in getting along with others from an employee relations perspective, and job safety? Scoring that checklist is generally best done by persons who know the learner very well and have observed the individual in their natural environment. You don't have to do all of them. You might have an individual for whom you truly wondered about community living, and new opportunities are arising for community integration, and you're concerned about whether or not they have the skills they need in that context. Items are checked off only if the student can do them independently, or you can also optionally code the various kinds of prompts that might be needed by the individual. And as in many other assessments, we stop filling it out when a number of consecutive skills are missed within the module. In this case, for the CALS, it's 10. Here's an example of eating skills, and you'll see that it goes from the simplest thing, sucking from the nipple, holding and drinking from a baby bottle, or swallowing a spoonful of soft food, all the way up to cutting meat into bite-sized pieces with a fork and a knife. Another assessment that kind of is much more relevant for the older learners, like the CALS, is the AFLS. Um, and this is the assessment of functional living skills. And it was also developed by Partington. You'll remember the ABLES, which was the first one that we talked about. The AFLS is very much like it. So all the things we talked about that were relevant to the ABLES are relevant to the AFLS. Um, so you may also remember that both the VB-MAP and the ABLES were designed for younger learners or developmentally younger learners. This is designed for all age groups. This is definitely relevant for adolescents and adults, and is going to look at those community relevant, job relevant, and independence relevant skills. There are 6 assessment protocols. There are basic living skills, home skills, community participation skills, school skills, vocational skills, and independent living skills. Like most of the other instruments we've discussed, it's really important that it be filled out by people with frequent and direct contact with the learner. Hence, as an RBT person, you will be called on to give information for these assessments because of your amount of direct contact with the learners in your care. There are other sources of information too. Parents might also be contacted, the learner might be directly observed, or goals might be formally presented as tasks to determine their level of competence in them. The scoring is exactly the same as what we discussed for the ABLES, and the score is based on what the learner typically does. In other words, you don't answer based on their best ever performance. We answer based on their most likely performance. And you score the items that you know. You go back and present formally those tasks you were not able to score. If there are discrepancies between reporters, mom says he can do this and you were not able to get him to demonstrate that and have never seen it in the school-based settings, that's commented on so that that information is preserved for anyone who might be trying to interpret the assessment at a later point in time. Here's an example of the assessment of functional living skills from the AFLS, and you'll see that it's very similar in setup to what we looked at for the ABLES. Here, the first task is returning appropriate greetings, where the objective is learner will return all greetings with eye contact. The question is, do they return the greeting and look at others while doing so? And the criteria, you get a 1 if you return the greeting but you require verbal prompts to make eye contact. You get a 2 if it's consistently done with eye contact. Now move down just a little lower to goal 3, where it says excuse me when accidentally bumping into others. The learner will excuse themselves after accidentally bumping in. And a 1 is for they say excuse me or I'm sorry when provided with verbal prompts or reminders. And a 2 would be if it's done spontaneously and if they do that consistently. So one of the nice things you see certainly emphasized in many of these assessments, particularly the ABLES, the AFLS, and also the VB-MAP, is this concept of spontaneity, the ability to do it without instruction. And that's so centrally important for this population of learners who we often have true dependency on others in their environment, whether it be to script for them exactly what they should say, or whether it be a reminder of what the rule is. But we're really looking for individuals who can do these tasks without that level of assistance. And if the individual cannot do these tasks without that level of independence, it's absolutely essential that we know it for program planning purposes. Because, in fact, we might target the level of independence for a skill rather than targeting the acquisition of the skill itself. Okay, going further down that list, you'll notice number 6 on the bottom. Excuse yourself when interrupting a conversation. They will use a variety of phrases to politely interrupt. Pardon me, may I interrupt for a moment? I'm sorry to interrupt. And here you can get from a 1 to a 4. A 1 might be, They approaches and signal or tap others to indicate their willingness or desire to interrupt. A 2 would be they use a phrase, but only with verbal prompts. So somebody might say to them, remember, what's the polite way to interrupt? A 3 consistently interrupts politely using at least one phrase. And a 4, the highest level, is going to be consistently uses at least 3 different phrases. So here we're looking at variability, the breadth of that skill. You know, can the individual do this in multiple ways? That increases the likelihood that it really applies in the natural context as it should. When someone has only one way of doing something, one sentence they use, it's not as applicable across all contexts as it is when they have the ability to truly alter what it is that they're asking for. The SSIS is a way to look at a number of other skills that can be done for all students in a classroom in less than 20 minutes. So this is often done for class-wide interventions or vocational programs where there might not be the kind of time that's required to do massive amounts of individual assessment. There also may not be the resources to do so. So there's a lot of focus on social skills in here, but it targets an individual's social skills, problem behaviors, and academic context. There are a number of different rating scales that can be used. You can use the SSIS for individuals as well as for small groups, and it looks at it from the standpoint of parent, teacher, and student. It's generally used for individuals 3 to 18, although it's applicable for adults as well. The student level for reading that's required to be able to fill out the scale appropriately is a 2nd grade level. Parent level is at a 5th grade level. So that helps in terms of it being comprehensible and understood by those who are going to serve as raters. I mentioned the student scale, but just to elaborate on that a little bit, it's a way for the student to rate his or her own behavior. Now, not everyone is going to be at that 2nd grade level of reading, so they might require some assistance for reading and for using the rating scales. But it's a very nice way to integrate the learner directly into their own assessment. And the 2 areas that are focused on in the student assessment are the areas that often get the most attention from implementers of behavior analytic interventions, social skills, and problem behavior. And they indicate whether a statement is not true, a little bit true, a lot true, or very true of them. Teacher scales look at social skills, problem behavior, and academic performance, and they rate it as never, seldom, often, or almost always. And it also looks at, for social skills, whether it's important, not important, or critically important. Here's an example from this particular assessment, looking at a variety of skills. Under the social skills, you'll see it includes things like asking for help from others, following directions, saying please, being well behaved when unsupervised, showing kindness to others when they are upset, staying calm when teased, saying thank you. So a lot of kind of those nuanced skills, those things that make the difference between somebody who is considered a little bit more socially savvy and somebody who may have more difficulty following social rules or fitting into a particular social context or demonstrating socially expected behaviors. Now look at problem behavior. Acts without thinking, preoccupied with parts of objects, fidgets or moves around too much, withdraws from others, repeats the same thing over and over. And the last thing we want to talk about from an assessment perspective that you'll also watch some videos on and learn a great deal more about is preference assessments. Preference assessments identify stimuli that the person prefers, and we can then determine whether those preferences, those preferred items, could actually be effective reinforcers. Could we actually use them to increase target behavior? That's what we mean by a reinforcer, if you remember it definitionally. We also might be able to look at the relative preference of those stimuli. Here's something I absolutely love. Here's something I like a lot. Here's something I like. Here's something I would accept. And here's something I truly do not like. And preference assessments are generally done either observationally or via self-report. Self-report might be kind of an interview, asking the individual, what's your favorite food? What are your favorite toys? What things do you like to do when you have free time? Or what would you do a lot of work for to get? And we can then rank order for the individual which items they like the most. So here you might ask somebody to circle the games or activities they like and then rank order them with number one for things they like the most. And it also has blank spaces for the individual to write down a number of different things that they might enjoy doing. In behavior analysis, we do more observational preference assessments than we do self-report ones. As you know, observation and real-time observation are kind of hallmarks of applied behavior analytic interventions. And so that's true in the preference assessment realm, just as it is elsewhere in our work. So in a free operant observation, we might just watch the person in their natural environment where a number of interesting and high interest items have been placed, and we might just watch. How long does the person play with the Legos? How long does the person look at magazines? How long do they go to the computer and look at YouTube videos? So that would give us an indication of which things they're liking the most. We might also do trial-based method, where we might look at approach of stimuli. So we might present just one thing, the koosh ball, and show it to them and see, do they accept it? Do they manipulate it? How long do they keep it? Do they toss it? Do they throw it on the floor? Those would give us indications of approach or avoidant behavior. Or we might look at comparison. So we might have an array of stimuli, say 7 different things, and we might have the individual select the thing they want most. And when they've played with that, we might then present the remaining 6. And when they're done with that, we might then present the remaining 5. In that way, we can get a hierarchy of stimuli. Which ones do they like the most? And something in between those two, either presenting them individually or presenting an array, we might just present 2, this or that. And we see they take A versus B. They take, B versus A. That would give us a sense over time of which items they're most likely to take in terms of a level of preference. Here's an example of a data sheet that might be indicated in terms of a number of different stimuli that are being paired with other stimuli in the array. So this has 9 stimuli. Number 1 is paired with the second, number 1 is paired with the third, number 1 is paired with the fourth, number 1 is paired with the fifth, and so on, until we've had all the possible pairings. And we can then indicate the frequency with which it was selected, hence getting that hierarchy of which ones is the individual most likely to work the most for. And here's one that's presenting 2 items at a time, where that sort of forced choice procedure, where I'm going to take A or I'm going to take B, and it enables us to systematically track which item in fact was selected. This is a data sheet for something that we call the multiple stimuli without replacement. So that's the array of 7 followed by the array of 6 followed by the array of 5, for example. And all of those assessments are really important to understanding the learners that are in our care. All of the initial assessments, the ABLES, the VB-MAP, the AFLs, those all give us a really nice sense in an in-depth way of where is this person in the development of these skills? Where are the holes in their abilities? What might be initial goals for us to work on? Some of the other ones we've looked at, like the checklists or the self-report instruments, kind of round out those assessments, maybe give us a little bit more specific information that could lead to goal setting or that might be relevant to community integration or other skills. And preference assessments is a whole different thing, really. It's how do we identify items that could be motivating to the learners that we work with, that can help us understand what we might use to effectively reinforce behaviors for that individual. Okay, that's it for now.